Hi, I'm Sally Kraft. I'm the Vice President of Population Health for Dartmouth Hitchcock Health. We really work to bridge clinical transformation and work with the community and the resources in the community and the assets in the community. And our team at this point in time has really demonstrated enormous flexibility. We've changed some of the work that we're doing. For example, many of the greeters at the door are population health team members. We've been able to really work on making those connections between families, between care teams. We've been working on the telehealth projects with the clinical teams. We've been working on bringing patients together with their families. The patients that are in the hospital and aren't allowed to have family members, our team has helped to develop that virtual connection so that we can link patients through technology with their families that are out of the clinics. And then, probably even more important, we've been able to link our health system with our community in stronger bonds than we ever had before. We've populated several community coalitions, the Upper Valley Strong Coalition, the Greater Sullivan County COVID-19 Response Team, and a number of other community groups where we've been able to provide resources and expertise and people to help those community organizations as they respond to COVID-19. I think that reinforcing those good public health measures is the single most important message that I can pass on. Again, physical distancing, which doesn't mean social isolation. It really means physically distanced but socially connected, wearing a mask when you're out in public, washing your hands, and keeping your environment as clean as possible. And with those simple, not high-tech, simple, low-cost interventions, we've been able to make an enormous difference in flattening that curve in various parts of our country. With COVID-19, the Dartmouth Hitchcock Echo team rapidly stood up 4 unique courses that are being delivered through the Echo platform here at Dartmouth Hitchcock. And those courses are all addressing COVID-19 challenges in different communities. For example, we have a COVID-19 Echo bringing together our infectious disease experts and spreading knowledge and education to primary care providers across the northern New England region. We have a COVID-19 Echo that's focused on maternal health and perinatal health and bringing together people across Maine, Vermont, New Hampshire to learn on how to provide safe maternal and perinatal care during the COVID-19 pandemic. We have a COVID-19 Echo that's focused on our community health workers. These are the frontline workers who are helping all of our patients with who are struggling with food or housing insecurity or job insecurity. And our community health workers have had to change radically the way that they're working. So community health workers across all of northern New England, particularly in New Hampshire, are coming together to learn from one another and to learn from experts about what is this disease? How has it impacted our patients? How do we work with our patients differently? And how can we best prepare our communities and our populations for dealing with COVID-19? And finally, we have a very exciting COVID-19 Echo course that is focused on employers. How do we support our businesses in northern New England as they begin to restart their businesses and keep their employees safe, keep their customers safe, and to really practice the highest evidence-based practices for keeping everyone safe in the community while we work to get businesses restarted.